Okay, Mr. Noah, we are live. Good morning. Oh, good afternoon.
It is a good afternoon here. It's 4 o'clock,
It's 4 o'clock. Good morning in
4:30 p.m.
yeah, in New Jersey. It's good morning. It's 8:30 a.m. So I want to welcome you to our Health and Wellness Friday. Thank you so much for accepting to come and talk to us.
Thank you.
It's unfortunate that I did not make this announcement because I'm trying these things for the first time and I want to get a little more organized. But anyhow, I said we're just going to try it and see how this works out. So again, if you're
Mm.
finding me for the first time, my name is Penny. I come here 5 to 6 days a week. My goal is to inspire you. My goal is to hope and pray that you're going to listen and learn one or two things that you're going to apply in your life that is going to give you a healthy life, a life full of purpose, and a life where you're going to self-reflect and take care of yourself. I had dedicated Friday to health and wellness in the past year, but because of my work, I didn't have enough time to come here. But I thank God that I'm getting to a space where I'm going to create 30 minutes every Friday to talk to someone who has mastered something that they've put their time, they've invested in it to come and talk to my audience. So that way we can have a healthy, prosperous 2025. So with that said, when you come in, I see a lot of you have joined in. Let me do the same. Share this video, invite your friends. Let us talk about our health and wellness. And today we are going to talk to our family and friends that are in Kenya. And that is the reason I have Noah here. Last week, we had our friends from America talk to the, the audience that is in America, although a lot of you tuned in from Kenya. And today we want to focus um, to our audience that is in Kenya. So Noah, welcome again, once again,
Thank you.
and
Thank
thank you
you.
so much for accepting to come and talk to us. And I just want to start personally about sharing my story about my parents. And growing up, um, we came from a culture where in America, they don't want us to say fat. They want us to say big boned. When you are big boned, it was a way of status. That's how people respected you. The more big you are, the more respect you have. So we grew up in a culture where being overweight gave you good status. And the reason I invited Noah here, he's lived through a couple of generations where he understands where I'm coming from in terms of culture and how we view our health and wellness when it comes to food. And Noah is going to walk you guys through the past, where we came from, where we are, and where we are going. And what is going to highlight also is uh, the pain we inflict on ourselves, or the pain that was inflicted on us. When I talk about the pain that was inflicted on us, some of us grew up in poverty, like we had nothing. I know people who are here, Kenyans in America, who could not afford cake. So when they go to America, they started buying cake every day, cake, 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 cake. So that's the past trauma. Present, you're overeating because now you have all this food. The future, you create diseases that you cannot treat. So with that said, I'm going to let Noah take it on, and we are going to talk just for people to get the information. And as usual, I tell people all the time, people think people are selling products. I could be selling spinach or chicken eggs fresh, okay? People are quick to think, what are they selling? What are they looking for? Are they trying to make money from us? No. I could be selling spinach I told them last time, I have enderema right here. If I can show you my camera, this is enderema growing in my house. Can you see that? Let me just get her. I could be selling this. See that? That is enderema in my house, right? That is fresh vegetables that I can pick from my plant there and put it in my eggs for breakfast. I can do that. And if you cannot invest in your health, nobody can do that for you. So Noah, I'm going to give you the audience. Take it from there. And as we continue, I will chime in when I need to chime in. And welcome again.
Thank you. Thank you, Penny, for giving me the chance to speak to our people. And it's a rare chance indeed. As Penny has said, I'm Noah Sangani. I'm a village boy, village man, village grandfather. I'm a married person with one wife and 3 adults who are boys. One of them is married. I have 2 grandchildren. In the next 2 weeks, 16th of January, I will be 63 years old. Tumekula jumfi kidogo.
You've been around.
I've been around. But that journey has not been easy. Noah has been working in government of Kenya for 35 years, rising from the university as a children officer, fresh graduate, to become the director of children services in the Ministry of Labor and Social Protection, and now retired. This is 3 years down the line. There is a reason why I'm giving you that story. And it is a bit of a journey. As Penny said, our culture is interesting. There is the positive aspect of our culture and there is the negative aspect of our culture as it relates to health. This person speaking to you was born and raised in the village, Tombe village in Nyamira County. I went to rural schools. The only place I went far is in Nyeri for high school, and then the University of Nairobi. As I grew up, indeed, people in the village who are very fat, we really respected them. Kabisa. Wale wako na tumbo kubwa.
Heshima.
Tumbo kubwa, heshima.
Yeah.
Hata unamsalamia with 2 hands. Why? Because that is the way we were brought up.
And it's because also they could afford, they had money to afford a lot of food and they were eating meat.
Of course. Yeah. Of course.
Yeah.
And the precious commodity called bread.
Yeah.
It was in plenty for them.
They could afford bread.
They could afford. They could afford to eat all that was necessary at that particular time. And so we respected them. So our culture taught us that, at least when I was growing up, that go to school, work hard, get employed, and then create your own wealth and eat what you are supposed to eat.
And get fat.
And get fat.
Yeah.
And that is exactly the person speaking to you today, called Noah. Of course, that journey, when I got employed, I went into the mode of taking my all my the food which I never had in Tombe.
Your salary, so you once you get paid, you buy the bread, you buy the meat, you are buying everything you didn't have to eat.
Exactly.
Yeah.
I think in my mind, maybe I was compensating. I don't know. But I guess so. According to me that time, living healthy was to eat all the processed foods. And there was always meat on my table. And of course, bread, chapo, and the rest. That is chapatis and the rest.
A lot of carbohydrates.
A lot of it. A lot. And that one I can for sure can confirm that I ate a lot of carbohydrates. And of course, coming from Kisii, ugali is the main thing. You can take it lunchtime, supper. It's not a big deal. But Penny, I can tell you that has brought a lot of issues on me. A lot of issues, health issues. It even became worse, Penny, when now I rose up the ladder in government, and especially when I became a director. There is the kind of satisfaction one gets, sub-comfort zone, and I kept on becoming fat and fat. I didn't realize it. This person speaking through here to you here went up to 119 kgs.
How much is that in pounds?
In pounds, I really don't know how, but you can calculate there. But 119 kgs. I call myself an elephant.
At 262 pounds.
Yes.
Yeah. My
waist was 46. Long trouser waist, 46. I never used to have my clothes in one set. The coat candle, that's the blazer, and the long trouser. It wasn't the best, but somehow I didn't know. I didn't find it funny. My shirt was size 20. I didn't find it funny. But I started knowing what that means to my health. I think about 3 years to my retire, my knees started failing. I couldn't walk up the stairs. Ilikuwa na hema sana. I don't know how to call the hema in English.
Breathing hard.
Yeah, exactly. Exactly. If I walked 2 floors up in NSSF building, it was chaos for me. That is when it hit me that I was in bad shape. And then my parents had passed on. They had diabetes, both of them. My weight, the 119 kgs, I was properly in the line of, let me call it the line of duty of being diabetic. And for sure, I was, for sure.
And you know, no, you have to really, I'm sure you said it, but you need to be clear that unknowingly you put yourself in that line of diabetes.
Exactly. Yeah. Exactly. I put myself there because of what I was eating. I never had time to exercise. In the course of my duty as a director, I was going all over the place, in and outside the country. No time for exercise, meetings up to late. I didn't have time for myself.
Serving, you were serving.
I was serving others, but forgot about myself.
I want to throw in, you know, one thing I don't forget when I've been to Kenya, you're a driver. The driver used to, you don't even drive. The driver used to wait for you outside When you get to the office, there's somebody giving you tea.
I'm
Please throw
telling
that
you,
in. You felt accomplished. You are accomplished.
I had reached. Nilikuwa nimefika.
Good. Yes.
That is the bottom line.
Yes.
But I was taking myself to the grave willingly.
With young children.
With a wife.
Yeah.
That's what it means.
Yeah.
And Penny, I want to confess here that I never used to see it as a problem. Never used to see it as a problem.
You know, I wanted to interrupt you, Noah, for a minute, but I let you speak.
Please do.
My husband is not here, and usually I'd like to be truthful. For me, I'm into health and wellness. I'm very passionate about health and wellness. But every time I pick on my husband about health and wellness, he laughs. I don't know what your wife was doing, or in all this, you've not mentioned your wife or anybody. You've not mentioned, did anybody come to you and say anything? And sometimes it could be the wife, it could be the sister. Did anybody like say, hey, Noah, did anybody tap you?
My wife, Margaret, I normally call her Madam CEO. She used to make a lot of noise. The kiss in me used to tell me, oops, Mom, you talk. Okay. I didn't have a problem myself. I didn't see it. You can see where culture is coming from.
Yeah.
Pride, I think that was one of the things. Nilikuwa nimefika.
Culture.
Culture, I've mentioned the culture. Nilikuwa nimefika. And I didn't see it as a problem. But Penny, let me tell you, she made a lot of noise. I'll speak about her later. She made a lot of noise. That's why I'm here. She made a lot of noise, but I didn't see it as an issue. And this is why now once diabetes hit me hard, the goodness is that, Penny, I accepted it myself. The first time I was tested.
Did you get to a point of taking medication?
Yes, I've been taking medication. This is the 4th year.
Okay.
Up to last Saturday.
What type of diabetes?
Type 2.
What stage? Type 2.
Lifestyle type. I brought it to myself.
Which is that's what I'm saying. So far, you guys, if you're following, no, we are talking about the past, we are talking about the present, and he's going to move you guys to the future, because lack in the past, present now you have, then you create a problem, and now this problem is going to be carried on to the future. Go ahead, Noah.
Now, the other issue I wanted to tell you is, and the audience, is that there's something which happens to men, and I hope I will not hurt any man here, but if I hurt you, please go take action. Go take action. Because what men are doing is that they are on denial, total denial. Penny, I've just mentioned that I took myself to the hospital, MP Shire. I told them to test me about diabetes. That is, remember, 2 days after my mom had passed due to diabetes. And they also were not very, very keen to test me. But I told them I'm a social worker. I'll take it up. I accepted. I told them I'll accept it the way it is. And I think that acceptance, Penny, is what has put me up to this stage. I know men are on denial mood. There are so many men who are diabetic. Their wives don't know. their families don't know, wana hide kukunywa madawa, they are hiding from the rest of the family members so that they don't know whether they are taking any medication. Those men will die. Penny, those men will die.
That
For a
is-
fact. For
yeah.
a fact, they will die.
And then we are going to say, or the wife is going to say, oh, he was fine, but he wasn't fine.
Exactly. He wasn't fine. So, Penny, as I'm speaking to you right now, me, I've been open. I've been putting these things on my page. And so many men are coming back to me to ask me, no, what is this are you doing? Why should you tell people you are diabetic? And you know, Penny, the person telling me that is diabetic.
Oh, he wants you guys to keep it a secret.
To keep it as a secret.
But again,
That is
don't you think
denial.
also that's part of culture where don't talk about your business in public, and that's your health.
It is up to them, those ones. Let
Yeah.
them go and keep quiet. No, I will not keep quiet because I realized that when I accepted it, I started my journey. And that is why, Penny, I'm here to
Yeah.
tell people, both men and women, that when you accept something positive, then you will be able to move forward. So in terms, if I can wrap that part of culture, the Kisii men, I'm now speaking to the Kisii men here. The Kisii men, those people with money, don't hide, don't hide. You'll die. For sure, you will die. And I'm not threatening anybody. I'm just stating a fact that can you come forward and tell your people that you are diabetic and you are working on it. Get that support system from your household, just like Madam
Because
CEO.
also
is doing.
the food that your wife prepares has to align with your current health condition.
Exactly.
Yeah.
And the man has to accept to go through that process. Because I have been to homes where people are diabetic and I get shocked the kind of food the people are taking. And then somebody says, oh, sikulala vizuri, I didn't sleep well, or I'm feeling my legs are numb. And yet, the kind of food the person is eating is not a healthy food. I'm not saying it should be expensive. No, no, no. I'm saying very healthy food and it's available. So Penny, there are so many people who are eating recklessly. And this is culture, where culture comes in. Ile ambao hukukuwa nayo, what you didn't have, now you have. How can I not eat all these things? And one is not healthy. Mtu wako na tumbo kubwa, a big stomach.
Mm-hmm.
You are eating recklessly. For sure, that weight will continue and it will impair you badly. In terms of, especially the men, the prostate. Noah had enlarged prostate. Noah nilikuwa na susuo vibaya sana. Urinating all the time. Why? Because my prostate was enlarged because of the weight. I was obese. But once I managed that weight, now it's okay. My prostates are now normal. You see a lot of men very well dressed, but ukimwangalia vizuri, you see the person very well Penny. Kuna masusu imekuwa kwa longi hapo, and the person is not even aware.
Yeah, and again, because of culture, it's embarrassing, and
Exactly.
You don't want to talk about it. And then
yes,
you can touch partially, because now you're talking to a lot of people. We have men in their 30s, actually, between 30s and 40s, who are suffering from erectile dysfunction because of even diabetes.
Yes.
Diabetes can affect your sex life big time.
Penny, not even sex life. Penny, people are divorcing currently, separating currently. Reason? Young people, less than 30, in the 40s, they have stress leads to diabetes, hypertension, high pressure.
Yeah.
They cannot perform sexually.
Yeah.
And yet, especially if you don't manage your sugar levels, those ones who are diabetic, sex will be a thing of the past. And then there will be quarrels in the home. This is where you hear a man saying, I have provided that wife with everything. Everything is in the house.
Yeah.
What does he want? While actually the main cause is not the things that are missing in the home.
Yeah.
The main thing is that the sex life is dead.
There's no intimacy. The intimacy
There's
that
no
brought them
intimacy.
together, the intimacy
Yes.
that helped them have the children that they have. You know?
Yes. Yeah.
And they forget, they think like giving shelter or giving financial support is enough.
Exactly.
Yeah.
And yet, this is a person who is diabetic and nobody knows. Not even the closest relatives know. They don't know that this person is either diabetic, either is on a high blood pressure or hypertension like that. And these things are manageable. They are manageable.
And Noah, while you're at it, you've not mentioned depression. So depression is big on men. And men try to hide or run away from depression, and that's why there's high rates of suicide among men. Because you have all these problems you're talking about, and you don't want anybody to know. So now what happens, you just give up. So culture, again, talk about keeping those secrets which lead into depression. And you've not even spoken about alcohol because you don't drink. Some of these men fall into alcohol. Non-stop.
Penny, Penny, mental health is a big issue. Is a big issue. And most men now, what they are doing is they are going away from their homes to go and drink themselves silly out there.
Yeah.
They hide under the bottle of beer. And in Kenya here, there are several cheap liquor available. Several. I was home, just came yesterday. And it is very depressing, extremely depressing, Penny. My age mates are extremely very old. Very old. Why? Because of over drinking. And that is, it has led them to, because of so many problems, they cannot manage. But not only my age mates, young boys, young ladies, they have issues with their health, mostly because of depression. So the culture aspect, Penny, I was talking about, is that men don't want to talk about their problems. They would rather die with those secrets.
Yeah.
And I want to tell men, please speak up. And more so, take care of your weight. The main thing for men is weight. If you take care of that, if you reduce those kilos, you will see a lot of changes in your life.
No,
And-
let me chime in. Let me say something that is very petty and yet very big for the men. I told my
Yeah.
guest last week, I have told my husband snoring can be a cause of divorce. If you go to divorce court, you can find a person that divorced somebody because of snoring, not just because it's snoring. They've been eating, they've been together, the man is eating or the woman is eating, somebody is just eating, even here, right?
Mhm.
And now at night, you're shaking the whole house. The children can't sleep, the wife can't sleep. And when you wake up, you run straight to the kitchen. You see?
Mhm.
And now if you're telling someone that, you know, my wife left me because I snore, that's a laughable. It's like a joke. Because they don't understand this wife or this husband is not getting enough sleep.
Yeah.
The children are not getting enough sleep.
Mhm.
So
Mhm.
as you're talking about that, people need to understand that we are moving away from the culture of enduring African men more so, who because of their status and culture are
Mhm.
defiant.
Mhm.
You're defiant. There is nothing your wife is going to tell you. You're going to snore. If she doesn't like it, she can leave. You marry another woman.
You bring more stress, more problems to yourself.
Yourself, yes. And that's why I wanted you to come as a man, because it's not easy for men to publicly come and talk about their health and what they're doing. And then the other thing now I want to touch on
Mhm.
is being a provider.
Mhm.
So we come from a culture where the man's job was to provide.
Mhm.
In that culture, you know, we moved away from the villages. We left,
Mhm.
including you. But I think you had a good chunk of your childhood in the village.
Mhm.
The women stayed home and cooked and cleaned, while the men went out to work and provide.
Mhm.
As time went by, which is you now, you still did that. You still left the home to provide.
Mhm.
But now your wife is also leaving the home to provide.
Mhm.
So
Mhm.
now your mindset, you're still thinking, I'm bringing the money, she should just cook and have food for me to eat.
Mhm.
You're not taking responsibility of what you're putting in your mouth. As long as you brought the money to the home,
You should eat.
you should eat. And you should eat not
Mhm.
just to eat. You should eat a lot of meat. You should eat bread. She should just cook for you. But if your wife tells you, don't eat too much, in your mind you're thinking, I brought the food. What's wrong with you? What's your problem?
Penny,
Yeah.
those are the men I'm speaking to today.
Yes. Yes.
Those are the men.
Mm-hmm.
Me, I'm basically a village person, as I said. I've just come to stay in Nairobi because of the kind of job I was doing. I'm now a resident of Nairobi and Machakos, and the Kisii Nitombe. But that does not mean I shouldn't provide for the family. I provide.
Yeah.
But I am also very careful on what I eat.
Yeah.
I never used to be careful. I never used to be. Yeah. I never used to be that careful. But when I found out that my health is a challenge, I had to listen to what Madam CEO was preparing for me.
Yeah.
I had to reduce.
Yeah.
I had to be very careful also, because imagine if, like I've just told you, I go to parties all over the place. I come to the house, I eat. If I continue doing that, I will not be alive for sure. I will not be alive. So it is not, you can provide, yes, but be conscious also on what is to be eaten on your table. Be very conscious.
Noah, you can't see the questions, but Evelyn Osano is asking a question. Can diabetes cause
Yeah.
non-stop urine passage in men?
Can
diabetes cause non-stop urine passage?
You are breaking. You are breaking. You are breaking. You are breaking.
She's asking.
Yes, please.
Can diabetes cause non-stop urine passage in men?
Exactly. That is me. That was me. That was me for the past 3 years. Actually 4 years. Why? Because diabetes is a lifestyle. It affects all the veins. It affects all your the body systems. And
so Noah, so you want to tell me some of you men we see out here, you're wearing diapers?
We check it too, but that's the truth.
That's what I'm doing. So you guys
that
are wearing.
That
in
is
America,
why
we
you
call them
see.
defense. Yeah.
Penny, that is why you see in Kenya here. Like yesterday, I was traveling from Nyamira to Nairobi. You could see a man just drive to the side of the road and stops and starts urinating.
Without looking around.
Mercy. No mercy. No mercy. Why? Because he can't stop it. He can't stop it. And it is
in
true.
other words, you're saying there's a lot of men, I mean, practically, who might be wearing pull-ups and they are maybe in their 30s, 40s, because if diabetes affects you, you cannot control your urine, then you have to find a way to stay dry. So meaning you're wearing depends, you're wearing diapers, adult diapers.
Literally, actually, you are wearing diapers because diabetes affects your prostate.
Yeah.
That's a fact.
Yeah.
People can Google prostate issues with men is on a higher level.
Yeah.
They cannot control their urine. They think that they have gone to urinate. They go to the toilet after 5 minutes, they are back there.
Yeah.
And a small portion of urine comes out, but very painful. This diabetes, it affects the back of the men have a lot of back pains because of enlarged prostate. That is why in Kenya here unasikia, you just hear hiyo ni a disease for the men. Why? Because it affects the men. And it's a very serious thing.
Evelyn is asking, is there treatment for non-stop urine passage for someone who's been doing it for 8 years now?
Yes. Yes. There is.
So I've pinned the number. Evelyn, I've pinned Noah's number right there. You can reach Noah. And Noah, as we are moving on, I wanted you've spoken about the environment and how where you grew up plays a role on how your health is unfolding. And we want to briefly talk about managing time and creating time for your health and wellness.
Penny, once I discovered the way to live with diabetes and manage it, it is managed by diet, good nutrition, number one. Number two is exercise. Exercise. And exercise here, it is serious exercise where you sweat.
Yeah.
and a good sleep. For me, good sleep.
Mm-hmm.
And for me, what has worked for me, it is I swim 3 times a week, Penny,
Mm-hmm.
1 hour non-stop. Like I have just come from Kasarani Sports View Stadium, where I was for swimming for 1 hour. I've just
Mm-hmm.
arrived in the house. Yeah. And
Mm-hmm.
I do it beautifully 3 times a week.
So you've
I
created
work,
time.
I have purposeful creation of time.
Yeah.
I create that time.
Yeah.
Penny, I do a lot of walking. It's a minimum of 10 kilometers per day, at least 3 times a week.
You've created a
I
time.
have created that time.
So we are going to say we or our viewers or anybody who's going to watch this video should sit and create a time.
Time. Yeah.
Okay.
Time convenient for yourself. It
Yeah.
can be in the morning.
Mm-hmm.
It can be in the afternoon.
Mm-hmm.
But do an exercise. I'm not telling people to go and swim. I'm not telling people to go and walk.
You are choosing.
But
Those are your choice. That's what you're choosing to do.
that is what I've chosen.
Mm-hmm.
I also do it in my house. My sitting room is a gym for myself in the morning.
Yeah.
YouTube. Yeah.
Yeah.
So you have to create that time. Purposefully create time for it. Also, look at what is convenient for you. And you don't have to do those exercises where you are residing. I was home. This is the only time I was home for 2 nights. Otherwise, I walk in the reserve Kondani, in the whole of Tomba. I must create 10 kilometers. Some people find me walking and they are asking, what's up? But I do.
And you know, that's another thing. You know, now, again, talking about starters, once you have a car, when people find you walking, they're like, what's wrong with you? Don't you have a car?
Exactly.
Yeah.
Yes.
Yeah.
I have one parked outside here.
Yeah.
But I do walk. When I go to Nairobi City, I jump into a bus, do
right.
my errands on foot. By the time I arrive in the house in the evening, I've actually created 12 kilometers, 13, sometimes 15, like that.
I'm going
walking.
I'm going to take you back to your physical appearance. From your one,
yes.
How many pounds was that?
119.
And that was the original weight.
That was the original weight.
And we are going to talk about the current weight and just talk about appearance. Culturally, again, you touched about that. When you're fat, you have starters.
Yes.
So all these physical, if in my home, when I come home, when I'm looking so small like this, my aunties were wondering why my husband is mistreating me. That's why I'm very thin.
He's stuffing you with food.
So they're like, oh, you are married to Kambani, there's no food. That's why you're very thin. So
yes,
your appearance is what gives you a good self-esteem. So back then, being fat gave you a good self-esteem. You felt good about it. But now,
yes,
we are living in times where, especially women, men are not so much doing it. Women are paying to go under the knife to look a certain way, to remove the fats.
Mm-hmm.
And a lot of them are dying, trying to modify their appearance. And you can attest that since you started your journey, you're looking different. Even you, when you look in the mirror, you know you look different.
Yeah. It has been a journey, a gradual journey, Penny.
Yeah.
It has not been a stiff journey, but gradual.
Yeah.
It has taken me, actually, you asked about support that I'm having, whether my wife gave the support. She literally dragged me to BF Suma. Literally. Yeah, she told me today you have to go. But what am I saying? Currently, I am 94 kgs.
Wow. Congratulations.
I look younger.
Mm-hmm.
Several people in this city bypass, they don't know me. People literally just pass. They don't know that it is Noah Sang'anyi.
And I'm sure some are asking you, are you sick?
Not you are sure. They have asked me several times.
Are you sick?
Several times. Noah, you retired and became sick.
Because you lost weight.
Because I've lost weight.
Yeah.
My appearance now is different, but I'm very happy inside.
Yeah.
Very, very happy.
Yeah.
I can't imagine that I'm wearing size 17 and a half shirt.
And now
and my waist is this morning there is a trouser which was 38. I had put aside because I bought a new trouser.
That's nice. That's congratulations.
Now it is fitting. Size 38 is fitting me.
And now we're going to move on to you said it's your wife who introduced you to BF Suma.
Yeah.
And
yes.
In the US, I don't know whether we can call them supplements or how did you transition to not doing anything to BF Suma? How you came to find out about BF Suma and how you transitioned to BF Suma?
Now, my wife had a challenge with her legs. Huh?
Mm.
She couldn't fit these shoes, the high heels shoes, because she had a problem with one of her left leg. Mm. The knee was really aching, but she didn't know that it was her weight which had caused it. She had grown fat, but a friend of ours actually told her to go there and get some supplements. So she went there. She was taken through a process. She got her bioscan done. She only paid 1,000, did the bioscan by medical doctors, and she was given supplements. She brought the supplements home. Noah being Noah, I just looked at her. She took it for 1 year in my house.
And that time you are watching, you're just watching.
While I'm watching and I'm diabetic, that time.
Mm.
But she's okay. She became lighter. Her skin became okay.
Yeah.
She's now back to her normal situation.
Yeah.
Now, me, I kept on going to MP Shire, but I think the wisdom, she just decided that I must go to see BF Suma doctors. I was a bit reluctant, but I eventually went, and I've never looked. I really appreciate.
Yeah.
Of course, I went there when I was 110 kgs.
Yeah.
I was taken through the same process.
Yes.
I was taken first of all through weight management, which I put on my status. The products which I put on my status.
I was going to ask you, Noah, to walk us through briefly the screening process. You get an appointment. You go there. Is it an office?
No appointment, Penny. You walk in. It is first come, first serve.
Okay.
In Utumisha House here in Nairobi, just next to Serena Hotel. You walk in, you pay 1,500
to
see the doctor.
Yes.
It is a bioscan. A bioscan is like a laptop where you place your light fingers, the 5 of them. In 3 minutes or 2 minutes, the whole system is printed from the head to the toe.
Interesting.
And the whole, your skin, your skin, your kidney, your liver, your prostate, everything is printed. And you start discussing with the doctor one by one. This particular day, I had gone to MP Shire to do my 3 months test. I had done all those tests, kidney, liver, and the rest. But I told my wife, I'll not tell the doctor that I am diabetic. I wanted to see whether that machine really will bring in the parameters. Penny, to my surprise, the parameters were the same. I actually handed over my tests from MPSHI to him. He's called Dr. Jay Bosire. He was actually teaching yesterday on Zoom on men health.
Oh, nice. I need to link up.
And he actually gave the team my story and my pictures as one person who has really benefited a lot from it.
So you made that scan, and then the doctor saw you, and then when did you go back again?
I have been going back after 3 months. I go there to check. When I go to MPSHI, I do those tests and I go back to a BF Suma to do the bioscan. They have always been the same. That is when, Penny, I decided this is something which is working for me, so long as I followed the nutritional aspect of it. And that is where now my wife became now a big supporter, very, very big supporter of my nutritional components. Until now, whether she's around or not, I know, Penny, I prepare it myself. I am able to do it. And this is where most men now will come in and say, no, I cannot go and cook. My wife has to cook. That's not no. Mindset change is critical here, Penny.
Yeah.
So this is where the BF Suma products, you take them alongside your hospital medicine until the doctor from your hospital who treats you diabetes tells you no. And this is what my doctor now did last Saturday for me. And he withdrew.
Let's talk about the finances a little bit, Noah. And this program, it takes money to buy medicine. It takes money to buy supplements. It takes money to buy food. When you're looking at BF Suma, how does it cater from the minimum to the maximum? What's the budget looking like for people who are willing to try it out? You say testing is 1,500?
It's 1,500.
Yeah.
Then you can, when you go in for tests, the products.
Yeah.
The products will averagely be around 15, 16, 17, 20,000.
For how many months?
It depends on your situation, on your results.
Okay, now we are talking about minimum 15 and maximum is what?
It's around 20, 25.
Okay.
Thereabouts.
Yeah.
But these are not things that you are going to buy at once.
Yeah.
And you can take because they are taken in stages.
Yeah.
Yeah, they are taken in stages. And then you asked me about the finance.
Yeah.
Where does Noah get the finance from? Of course, initially, I had to pay it from myself, from my savings. But Penny, interestingly, once people have seen my transformation,
yes,
people have now started asking me now, Noah, what is this? What happened? And then people go there. I refer people there. I become their sponsor. They also get well. There are some who have gone there, Penny. The people who are working with very bad pressures, high blood pressures, very, very bad. They are okay, Penny. They have now taken up their families. They have brought their families on board. They are okay. It's now becoming a chain, Penny.
So now,
and that
here in America, we call it a pyramid. When we talk about a pyramid, people shy away
Yeah.
from pyramid. But what you're talking about, I think what I'm getting, you could,
Yeah.
besides paying for yourself, once I come and bring my husband, my
Yeah.
husband brings the sister brings the husband, eventually your supplements will pay for themselves.
Exactly. That's what's happening to Noah.
So you're not
And
now
those
tapping
people who are,
into your savings. Yeah,
I am not tapping into my income. No, no, no.
very good. So we want
It
to
is,
also,
it is, even here in Kenya, people talk about it as a pyramid. There are some, those who don't understand it. But this is not a pyramid. This is where you have a supplement, which is, it touches a life. I've just given you an example of people who have been well. Noah is an example. For example, I am here. There are many people who have come on me. I have brought on board because they have seen me.
yeah, so
And
that's what
especially-
people need to know, that besides you coming out of pocket to pay, once you get in
Yeah.
it, when you
Yes.
invite more people, they are going to be
To
able
benefit
to help
also,
you. It becomes a
there.
business. It's a business.
It is a business.
Yes.
Right now, it is paying my bills. Penny,
That's-
it is
yeah.
now paying my bills
Yes.
because of the people who have come on board under me.
Yeah.
They have wamepona. They have
Yeah.
brought their own parents, their
Yeah.
own relatives, their own friends.
Yes.
Now people are, especially the men
Yeah.
who have the issues with their prostate.
Yeah.
They are doing it quietly, but they
Yeah.
are there being helped.
Yeah.
And from there, it has now become a business. You can even see the t-shirt I'm wearing.
Yeah. BF Suma.
Yeah. Yeah.
So with that said, I wanted you to talk about the finance part of it. So eventually, if we invite our friends, you could also have it as a side hustle. And no, I think I want us to wrap it with spiritual and having willpower, because we've spoken
Yeah.
for 1 hour. And I told you earlier, as a grandson of a pastor,
Yeah.
when we talk about religion, even here in America, we pray about things. We pray that this happens, we pray that happens. But you know, prayer without action. Remember, your grandfather was a big pastor.
SDA
who was
pastor.
praying.
Yeah.
Yes.
Yeah. Pastor
And
Mambia.
yeah, people need to understand that while your spiritual life is very, very important, you have to take action.
Yeah.
You cannot pray diabetes away. You can't pray weight away. You can't pray bad eating healthy habits. You have to pray so you can have the willpower to get up and do something. That is your last point.
Yes. Yes. Penny, it is true. All these things you can't do without God intervention. You can't. You can't, even if you try. But I have had several people say, let's pray over it. Let's pray over it. The person is sick, let's pray, but they don't take action.
That's right.
I was very disappointed while in Kisii, Penny. A friend of mine had asked that I introduce the person who was diabetic to diabetes products, but the person took a lot of time to reach out to me. I was very disappointed to be told that he actually died because of low sugar levels.
Can you imagine?
Something which is preventable.
Yeah, that's another thing. That's a big thing.
So it actually goes, you pray for it, but take action.
Yeah.
Take good food, do your exercise, avoid being confrontational to people, set good boundaries for yourself, and be cheerful. This world, you need to be cheerful to people. But also, take good care of yourself spiritually. Like I did, Penny, I was baptized in August.
Mm-hmm.
Yeah.
Yeah.
I was actually re-baptized. And I
Yeah.
spoke to so many people in camp meetings about what I'm talking to you here, Penny.
Mm-hmm.
And through that, several people have come on board. And I'm happy, especially the men.
Mm-hmm.
I'm very, very happy that they are now okay with prostate issues. The people who are in camp meetings of Green Valley SDA Church here in
Yeah.
Kasarani and Githurai.
Yeah.
That is where we need to go.
Yeah.
That's where we need to go.
Yeah.
Yeah.
So you've said important things. We need to control our mood.
Exactly.
We need to control our mind.
Mindset, positive mindset.
Yeah. We need to control the money.
Yes.
You know, when we get money, we allow money to control us. So we need to control our money and what we are putting in our mouth.
Into our mouth.
So the last thing you're going to do for us, Noah, I have pinned your number up there. You're going to tell us how people in Kenya are going to find you, because this podcast was purely done for people in Kenya.
Yeah, okay.
And even the people who are in America who want to consume those products can get in touch with you. So let people know how they can find you.
Me, I'm found in, I stay in Nairobi, in Kasarani specifically, Hunters. Many people come to my house to pick the products. Like I have a house called Kijato House in Hunters.
A shop.
A shop.
Yeah.
And it is on Google. You can pin it. It is there. Many people, when they need the products, they come here actually to get it from my shop. That number that you have given it, let them call me. Let people, especially the men, let the men wafunguke. I don't know how to put it. Wafunguke.
And you know, Moses Otieno has reminded me something I wanted to say. Thank you, Moses, but it had slipped my mind. For those of us who are in America, I'm included. I want you guys to know that my mother is in Kenya and she's consuming the product. So if you're in America and you have your parents in Kenya, take care of your parents. You don't want your parents to die of diseases that could have been prevented. So Moses, thank you for reminding me that we have our loved ones in Kenya who are our parents, our siblings. And even now I was talking to someone who just told me he lost a sister to diabetes that could have been taken care of.
Preventable.
Yeah. So Noah, continue. Sorry for interrupting you. I thought that was nice. Moses has taken your number. And Noah, I'm going to read the number and you can read it again if I don't get it right. Noah can be found on 0722813560.
Yeah, that is correct. That is my WhatsApp number. Anybody can reach me on WhatsApp, can call.
Yeah.
And I am normally in Utumishi House.
Yeah.
That is where we have BS Suma headquarters. That's where we have our doctors.
Yes.
I am there from Monday to Friday.
Yeah.
Please, on Saturday, I'm not available. Saturday is my day.
Yeah.
I'm normally off, but from Sunday, I am available. Please, while the people in Kisii who have relatives in Kisii, get in touch with me. We can connect you to our doctors in Kisii and Nyamira.
I was going to ask
the products.
And what about the other parts of the country, Ukambani?
Like the other parts of the country, we have BF Suma in Embu. We have BF Suma in Meru.
Yeah.
We have recently opened an office, a full-fledged office in Nakuru.
Yeah.
We have a full-fledged office of BF Suma in Nyali Center in Mombasa.
Yes.
In Wote, in Kitui, in Machakos. Those are our shops of ego shop. That is where I belong. And any of those places, it's the same procedure. Any of them is the same procedure.
And with that
So
said,
it is
no.
1,500 for consultation.
Yeah.
Nobody should be charged, should be told more than that. And anybody who wants to be a member, you pay 2,900 to become a member, and then you purchase the products under your name, because there are discounts under that. And there are also benefits, Penny, when you become a member. Like there are people who recently we had people who got vehicles, and we were having a big ceremony in KICC on 19th of December. There are people who have just come from US for a trip. There are people who have come from Malaysia. There are people who have come from Dubai. These are people whose company or BF Suma has been able to sponsor free because of the kind of volumes that they are bringing on board. They in December, Penny, one of the persons was given a villa. So these are benefits, medical cover for people who have reached a certain level in leadership in BF Suma. And this is something you can do it everywhere. Penny, you can do it, even you from there, you can be a member.
Yeah.
And you can purchase those products. Like now, very soon there will be an office of BF Suma in the US.
Yeah.
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 And I've gotten people already asking me, how do we become members? It is very simple. Many of you have national IDs. You only pay and become a member and be able to supply those products to your parents and relatives at home. Please don't have your parents die on things which are preventable, especially those who are in America.
With that said, Noah, me and you have been here for exactly over more than an hour.
More than an hour.
1 hour.
Yeah. Yeah.
On behalf of my company, PennyOFashions.com, I'm going to give you 10 vouchers. And these 10 vouchers are going to go to our viewers that are tuned in today. They will contact you through the number that is pinned there.
Yeah.
And you will give them the pass to get the screening, at least for them to know. If they want to proceed, they can proceed. But I'm going to donate because I'm very passionate about health and wellness. I'm all about preventative care. I'm all about checking yourself. I'm all about caring for yourself. And self-care is something that is so important. And that's how we build strong communities. If we take care of ourselves and then take care of others. And Noah, that's one thing. In fact, that was the last point which we missed about the culture of taking care of everybody but ourselves. Very important.
We should not forget ourselves. Like now, I have literally created time for myself, Penny. I mentioned that. It is self-care. The whole issue is self-care.
Yeah.
Because if you can't take care of yourself, then you can't take care of the rest.
Because if you die, then you'll left them there anyway.
I mean, you will have messed everybody else. Take good care of yourself.
Yes.
Be healthy. Go on holidays. Go on holidays. Men in the room, take your wife for holidays.
Yeah.
Don't keep money in the banks. You will die and leave those monies there.
And in fact, they'll waste that money because they didn't work for it. They will blow that money.
They didn't work for it.
Yeah.
Yeah.
Yeah. Parents, that's a good thing you're saying, Noah. Parents, don't overinvest. When you die, your children are going to sell everything and they'll end up being broke because it's not their money. They didn't earn it.
Yeah.
So don't be like our parents who never took time to relax. Take time and relax. No, I want to
Yeah.
thank you so much for taking your time to talk to me. I am truly grateful.
Thank you.
And next time I always say when we come to talk for the first time, we are everywhere. Even me,
Yeah.
I'm not that prepared. I didn't announce. I just wanted us just to come here and talk. And then next time we are going to talk about it, you'd have met the 10 people, my 10 people that I'm going to sponsor. And
Yeah.
then you're going to give me a feedback, which is probably we can do this in a couple weeks. I think 3 weeks is good. We give people time.
Yeah. 3 weeks is good.
3 weeks. Thank
Yeah.
you so much, Noah. God bless
Thank
you. By the way, before
Thank
I
you.
pen down, I waited to tell you guys last. I didn't want to ruin the show. Noah married my baby sister. When I say baby sister, not young
Sasa wewe
sister.
unaharibu maneno. Sasa wewe.
I want to spoil this video at the end. My sister, my mother's daughter, who's number 5 of my mom's children. Yeah. My sister Margaret, the woman that I looked up to when I was growing up. I mean, my sister Margaret was everything. When I tell you everything, she had fashion. She used to hang out. She was it. Then the man you are watching today, I had to put this out there as we finish. Just corrupted my sister and married my sister at a very young age.
I was also young.
You were so young. I don't
Yeah.
know. And Noah, she could have come to America. My sister was supposed to come to America, but you corrupted her and married her. And now that I'm seeing women are coming back home to look for husbands, I guess I'm glad you married her, because she could have come here and then no husband.
No, but eventually we came to America with the children.
Eventually you brought all of them to America. And then even me, eventually, I made the same mistake. In fact, I got married the same age that my sister got married. I think she was 21, if not 20.
21, going to 22.
Yes. As much as I thought she had made a mistake when she did that, I thought that was a huge mistake. Marrying into a Seventh-day Adventist family that was the grandfather was the pastor. I'm like, oh my God, what's going to happen to the clubs? What are we going to do with hanging out? I was so worried. But I have to tell you, Noah, thank you for the husband that you've been to my sister.
Thank you.
Thank you for being the family man you have been. And we spoke about your past, we spoke about your present, and we are speaking about, the future, where you're going with my sister. Now that, you have grandkids coming, you're like so active in your grandkids' life. You can't take the kids to the park when you're so sick, but if you're healthy, you can play with your grandkids. You can do things with your grandkids. I want to thank you. They always say for every obstacle, for all the challenges you face, something good comes out of it. I'm forgiving you again on social media for marrying my young sister like a little girl. And I'm so glad we are here today, many years later, to talk about health and wellness. And as my brother-in-law, I'm so proud of the turn or the direction you've taken. I know your village is not going to embrace the change that you're doing to talk on social media about your health and wellness, but you have to be the game changer. You have to you have to break those barriers for the next generation. Thank you so much. I appreciate it. I'll see you in 3 weeks.
3 weeks.
God bless you.
Thank you. Thank you so much.
Oh, wow. That was an hour and change. My goodness. Oh, I have to get used to shrinking these shows by getting prepared like ahead of time. But we have to do that for us to get prepared. I had started this show in 2022, and then so many things happened. I didn't stay consistent. But this year, I want to stay consistent, and I want to invite all of us to focus on our health and wellness. And the things that I always tell you guys that play a big role in your life, I always have to remind you, these are my guidelines that I use every day. Okay, things that guide me. All right. Let me see. I'm going to run them down because they are so important for you, because I have them in order. Where you live, your environment is very important. Okay. How you appear. Today I decided, because I'm talking to someone in Kenya, let me wear my African outfit. How you appear, how you manage your time, your social network, the people that you know. Today I'm sponsoring 10 people, and these 10 people are going to meet my brother-in-law Onoa, so you can start your health and wellness journey. The people, your network is your network. Your money, how you're managing your money. The little money that you have, you don't need a lot of money to live a good life. And if you live a good life, you're going to learn how to make a lot of money. So money, okay? The people you surround yourself with and your spiritual well-being. It's not easy to have strong willpower. It's not easy to just get up and do what we just did today, especially for our African men, even American men. Take care of your health and wellness. Have a happy Friday. Thank you for tuning in. Kindly, if you've not subscribed to my YouTube channel, do that. If you've not liked my Facebook page, do that. A lot of you that watch me, or a lot of you that consume my messages, have not subscribed to my YouTube channel, or you've not liked my page. Kindly do that. I take my time out of my busy schedule to come and talk to you guys. And the best gift you can give me this year is to like my page, subscribe to my YouTube channel, so we can reach more people, so we can learn to live a life with purpose. We are not perfect people. We are struggling day to day to be better people, but you can be a better person by making that one step. Take a pen and paper, start. They say a journey of 1,000 steps starts with one step. And today is your step, and I challenge you to do that. Happy Friday, and God bless you.